And then I'm going to get started then by introducing everyone and saying hello. I want to say hello to everyone on our meeting today, which is our first inaugural alumni seminar of FIENS Fellows. I'm Robert Dempsey. I have the honor of chairing the Foundation for International Education in Neurological Surgery. And this is one of our major objectives, where FIENS has often, for years, been involved in direct service to people needing neurosurgical care, and then quite a bit of educational work, which involves founding and supporting residency programs. But we're also very much involved in the postgraduate education of graduates and alumni of FIENS. And this includes alumni of our fellowship programs, both for additional training and for our training support for people to allow them to complete residencies and specialty training. We have today a very important seminar organized primarily by Dr. Jack Rock of Detroit and Dr. Ignatius Esene of Cameroon. And Ignatius is one of our very treasured alumni, having done FIENS fellowships for additional education at the completion of his residency in Africa, and then additional training to help him develop as an academic neurosurgeon in Cameroon. So this is very much a gathering of our graduates to continue this objective of continued care in neurosurgical world, but continually improving. And more, the teachers are being taught by the students. And you, as alumni, have become the teachers, which is our entire goal. So we're going to start this gathering of our alumni by having Ignatius and Jack, if he wishes, say a few words. Ignatius, it's a great pleasure to have you here. I know you are the force and organization behind our young neurosurgeons, and we thank you for those efforts. Please introduce the seminar now.
Thank you so much for the kind introduction, Dr. Dempsey. Let me share my slides. Are you able to see my screen?
Yes.
Yeah, so thank you so much. You're welcome to this FIENS Alumni Symposium, which is the first of its kind. And it's a great honor for me to present this symposium. You know, one of the missions of FIENS is to support and empower young neurosurgeons across the world, especially those early career young neurosurgeons in developing settings. So that's why FIENS created the Young FIENS, which is a forum for the young neurosurgeons of the Foundation for International Education in Neurological Surgery, with the goal of supporting these young neurosurgeons. And this has been done through their mentorship program, through fellowships, visiting professor webinars, and so on and so forth. So a few months back, we thought that it was necessary to bring together all the FIENS alumni together, but due to some challenges, it wasn't possible to have it physically. So we said we can start with a virtual meeting, and subsequently in future, we might go with a physical meeting. So without much ado, I want to sincerely thank everybody that made it possible for us to have this webinar today, particularly Dr. Dempsey, who is the FIENS the chair of the FIENS board, and together with all the FIENS board members. Jenny has been very resourceful. She's the one who's been putting together all the programs, sending out all the emails. I mean, what's inadequate for me to appreciate the effort and the time put in by Jack in ensuring that this webinar happens today. So without wasting much time, I don't know if Jack is going to have a word. Otherwise, I'll go into the program. So Jack, I don't know if you have a word or two to say before I go into the program.
No, I think you said it all in you and Dr. Dempsey, so I don't need to speak at this point.
Okay, thank you so much. So at this point, we are going to go into our program. Each speaker has about 10 minutes. We are going to take the questions at the end of the session. So in such a way that we have a general discussion encompassing all the presentations that have been done. So as our first speaker today is Dr. Tokhir Akhmediev. So he's going to talk about his fellowship experience and highlights about his training. So Dr. You have the floor.
Assalamu alaikum. Can you hear me?
Yes.
Yes.
Assalamu alaikum to everyone. Dear colleagues, it's a great honor to participate in this valuable event. Thank you so much for giving me the opportunity to present the report summarizing my clinical observership at the Orlando Health Arnold Palmer Hospital for Children under the mentorship of Professor Samer El-Baba. This invaluable opportunity was made possible through the generous support of the foundation of the FIENS and the Bassett Fellowship. Special thanks to the chairman, Robert Dempsey, David Sandberg, Jake Rock, Jenny Bray, to Treasurer Azam Said Ahmed and other staff, to whom I am sincerely grateful for awarding me this grant. So let me start with these words. Allahumma inni as'aluka ilman nafi'a wa rizqan tayyiba wa amalan mutaqabbala. So I'm from Uzbekistan. This country located in Central Asia, and its population about 40 million people. And the first recorded settlers is considered about the 8th, 6th century before Christ, and this is location of my country in the map. So Uzbekistan has 5 cultural and 2 natural sites on the UNESCO World Heritage List. There are Ichankala in Khiva, the historic center of Bukhara, historic center of Shahrisabz in Samarkand. This is crossroads of the cultures, and the Silk Roads as well passes through our territory. The nation is 96% of Muslim. The Uzbek language is one of the Turkish languages, and Uzbekistan's signature dish is Peh Low. It's typically made with rice, meat, and carrots, and other national dishes like this shurpa is soup made of a large piece of fatty meat and fresh vegetables, and other Noren and Lagman is noodle-based dish. You are all welcome to taste these all tasty foods in the future when you will come to visit our country. So to be honest, my father, he's also a pediatric neurosurgeon. I'm a pediatric neurosurgeon in my country, my father as well. So this year in September, we had the 4th Congress of Neurosurgeons of Uzbekistan in historic city Khiva in Khorazm. So in that Congress, I gave a presentation, and my father as well, and this is future neurosurgeon, inshallah. So this is Arnold Palmer Hospital, where I was an observer. This is my ID card. This is my mentor. Let me introduce him, Professor Samer El-Baba. He's one of the most experienced fetal neurosurgeons in the world, performing more than 100 open fetal in uterus surgeries for spina bifida. And this is a photo of my last day in that hospital, the ceremony of getting me this certificate of completing my observership. So I was just passionate and excited about this fetal surgery, because in Uzbekistan we don't do this surgery, but I just shared some information about this, that there is a possibility to treat these patients in the womb, in the uterus, and I posted a video on Instagram, and it's gained more than, nowadays it's more than 2 million views and about 80,000 likes, and there are so many questions related on these fetal issues. Basically, as you know, there are 2 options how we can treat this fetal spina bifida. There are 2 options. One is this open. To be honest, in Orlando, they do only open fetal surgeries. They don't do nowadays fetoscopic approach. So they do this C-section, 6 centimeters hysterotomy, and this MMC repair. Two types, basically open spina bifida or open neural tube defects we can treat with this prenatal surgery, and 2 types of spina bifida. One is myelin meningocele, MMC, second is myeloschisis. So during my fellowship, my observership, I have seen 3 cases with this fetal surgery. So I was very impressed with this surgery. So this is photo. He just finished this fetal case, and this is Whitney Palmer Hospital located nearby of Arnold Palmer Hospital, and this is hospital for women and babies. And I guess this was a case with MMC repair. So in this operating theater, there was a lot of specialists, not only neurosurgeons, as you know, this maternal fetal medicine, neonatologists, anesthesiologists, neurosurgeons, and a lot of scrub nurses and other staff. I counted about 17 staff in that operating theater. So recently in my country, 11th International Congress of Obstetricians and Gynecologists were held in November 24, 26. And in this International Congress, one independent section was dedicated to fetal medicine. So my professor Baba, he gave a lecture on the topic of prenatal spina bifida repair. It caused a lot of discussions, a lot of questions in the audience. What is the benefit of this prenatal surgery? As you know, according to this MOMS trial, if we do the postnatal repair, it's standard since nowadays. In Uzbekistan, we do the same postnatal repair surgery for spina bifida. The incidence of hydrocephalus is very high. It's about 80%. But if you do it prenatally, the chance of developing hydrocephalus, it's about 40%. It means you can twice reduce the hydrocephalus. So nowadays in Orlando series, basically Professor Al-Baba performed about 60 cases in St. Louis, and in Orlando till today he has done more than 60 cases as well. So in his series, the incidence of hydrocephalus is less than 40%. It's about 30%. And in most cases he tried to treat with ETP CPC, not with shunts. It means endoscopic surgical and CPC, choroid plexus cauterization. This method was introduced by Professor Benjamin Worf from Boston Children's Hospital. And as you know, in Uganda, in Africa, there is a special training center on this technique. And Professor El-Baba, he spent a couple of weeks in Uganda and just trained these ETV CPC surgeries. So I was so excited with this surgery, because if you do this ETV CPC, you can just avoid a shunt placement to the children. So then I did a request to the NeuroKids Foundation for providing us Storz fiber scope, because this NeuroKids Foundation, they provides fiber scopes for 2 emerging countries, 2 low-income countries. And as I know, they provided since today to Armenia and to Egypt this kind of fiber scopes. But unfortunately, due to some registration problems, they couldn't provide this fiber scope to our country. To be honest, in our hospital, we don't have this scope. None either rigid or flexible. All cases of hydrocephalus we treat with shunts. But if in the future we'll get this equipment, we can just can start with this ETV CPC, and we can do a lot of neuroendoscopy to hydrocephalus, to cyst, or we can use it during synostosis surgery as well. So they said me that I should apply them next year, and inshallah I will refer them next year about this supplying of this fiber scope. So this is a photo in the operating theater. This is my mentor. And this is another consultant in that hospital, Ryan Jafrani. He's very experienced on epilepsy surgery, on movement disorders, spinal dysraphism, and MR-guided laser ablation. So I have seen a couple of surgeries with this MRI-guided laser ablation. So it was very informative for me. In Uzbekistan, we don't have this possibility now. So this is another consultant, Professor Zachary Wright, in that hospital, and in the left, this is Emmanuel da Silva. He's observer from Angola, and we spent about 2 months in that hospital together, and we became a very good friends now. And all the staff of that department, a lot of physician assistants, they just support the daily life and daily work in that department. And a lot of MDTs, multidisciplinary clinics, clinics held in that hospital, especially on epilepsy. And this is Professor Peh Low. He's neurologist, the main neurologist, chief neurologist in that hospital. And they discussed all these patients with epilepsy, the pre-op, post-op, and these images, EEG data. They discuss all these issues related on each patient with epilepsy and make a decision how to do the patient free of seizures. So these robotics and SEEG, unfortunately, we don't have these possibilities in my country. So I have seen a couple RNS implantation to adult patients with this robotic, ROSA, robotic assisted surgery, and some brainstem biopsy with this machine, and this SEEG procedure when to localize the epileptogenic area which caused the epilepsy. And I also have seen a couple of procedures to use these zero EEG procedures. So let me introduce my abstract. This is our last published article about in the journal Clinical Neurology and Neurosurgery about split cord malformation tetrad cord syndrome. This was our experience. We just conducted the retrospective study of 56 pediatric patients. So recently, my hospital got equipment for intraoperative neuromonitoring. So we start to do more precise surgery and find this exactly filum terminale, the shortened or fatty filum, and just cut it. And we started to do this intradural release of these adhesions in the case of split cord malformation. These pre and post-op pictures. So this is Al-Bukhari Islamic Center located in Orlando in Florida. So I have visited this center a lot of time during my being there. So this is another Islamic Center located in my country in the city of Samarkand, and he's just reconstructed recently, and welcome to visit this exciting place. So this is my last slide, and I want to say some my appreciation to the FIENS and the Bassett Fellowship and all the staff because their support made it possible for me to engage in this enriching experience, which will have a lasting impact on my professional development and future career in neurosurgery. This observership provided me with exposure to world-class pediatric neurosurgical practice, advanced surgical techniques, and this MTT collaboration. I'm confident that the knowledge and skills I gained during this time will greatly benefit my neurosurgical training and future clinical practice in my country, Uzbekistan. Thank you very much.
Thank you so much, Dr. Akhmediev, for your very interesting presentation. I'm sure when we are going to visit Uzbekistan, we'll eat paklov. You know, he was a favorite dish in your country. So he just shared his experience in Orlando, where he observed a bit of pediatric neurosurgery, epilepsy, and robotic surgery, and the challenges in implementing what he observed back in his country. So we're going to move on to the next speaker, Dr. Peh Low. So she's going to present her clinical and professional experience after FIENS Fellowship.
Thank you, Dr. Ignatius, for the kind introduction. Hello, everyone. I'm Dr. Low from Malaysia. I'd like to thank Dr. Dempsey, Dr. Jack Raw, Jeannie, and the whole FIENS team for the effort in putting up this platform in order for us to gather here and learn from each other. Today, I'll be sharing on an ongoing collaboration in pediatric neurosurgery that is happening here in Sarawak, Malaysia. Partnerships and collaborations between institutions in lower middle income countries and their counterparts in high income countries is an essential component in global neurosurgery. A sustainable partnership elevates the level of care in lower middle income countries by improving training standards and enabling equitable access to surgery. So last year, there was an article in Neurosurgery that described the ecosystem of care model, which is a tier-based approach model for capacity building in global neurosurgical practice. So we are trying to link our ongoing partnership to this model as a reflection on our journey to date. So every collaboration starts with a goal. And so why do we need a partnership program for pediatric neurosurgery here? We can see the map of Malaysia on the screen now. On the left, we have Peninsular Malaysia, also known as West Malaysia, and on the right of the screen, we can see the East Malaysia. I'm working in Sarawak State in East Malaysia at the moment, and we are actually separated apart by the South China Sea. We have 3 neurosurgical centers in the state. The main center is located in Kuching City, and we have another center in both Cebu and Miri that caters for neurosurgical emergencies. Complex cases will be sent to Kuching, and some of the cases that require more specialized skill set will be transferred or sent across the South China Sea to West Malaysia. So the Bellwether Access in Malaysia study on essential surgery in year 2019 found that accessibility for surgical and anesthesia care was 100% in Peninsular Malaysia, but only 71% of the population in East Malaysia have the access to essential surgery. Even now in year 2025, we can see on the Google map that there are still areas and villages that couldn't reach the nearest neurosurgical center by road. They had to travel across the river, followed by log road or by air to reach the nearest neurosurgical centers. Kuching used to have the only neurosurgical center in the state for many, many years, despite the inherent logistic challenges that we have here. Hence, the neurosurgeons in the state worked together to set up 2 other centers to bring neurosurgical services nearer to the population. However, we do not have a pediatric neurosurgeon in the state, and there are some specialized surgical procedures in children that is still not available in our setting. Getting to neurosurgical centers alone is not easy for some of the population here, so seeking treatment in other states or countries becomes more challenging for them, and it poses significant burden to the parent and the family. In order to cater to this group of patients, we aim to actually set up a pediatric neurosurgical service in the state. To be able to do that, the local neurosurgeons require training to develop the necessary skill set, and we may need some additional equipment for the service. And this forms the basis of an ongoing partnership that I'm going to describe further. So in the year 2021, I reached out to Dr. Michael Levy, who was then the director of pediatric neurosurgical unit in Verdi Children's Hospital in San Diego, for an opportunity to learn more about pediatric neurosurgery and its related services. He was very, very supportive and very helpful. Following that, in year 2022, with the support from FIENS and some funding from my department, I traveled to San Diego and spent some time with Dr. Levy at the Verdi Children's Hospital. I think the time that I spent there forms the initial part of this partnership. Spending time at a children's hospital with an established service in place allowed me to appreciate the gap of existing services in the Sarawak state, and I think a collaboration is one of the efforts that we can do to bridge those gaps. At this stage, I think we form a new connection, talk about the need for a pediatric neurosurgical service in the state that I was working. Dr. Levy shared about his previous experience with mission trips to other countries, and we evaluate the presence of other specialties in my setting for us to work out what are the other specialties that he needs to bring into this partnership. He explored the language, culture, and social conditions in Malaysia, and we talk about the training and how the system works in the place that I work. This formed the foundation of our partnership and paved the path for us to move on to Tier 1. So when I came back to Malaysia in January 2023, we continued to communicate via emails, and we were planning for the first site visit for Dr. Levy and his team. We worked on the approval and support from local authorities, came out with a list of equipment that we have, and find out what else do we need to top up to get a service on board. We planned their accommodation, their transport, their visa. At the same time, we sourced for funding and support from the local organizations, and we gathered cases that we thought we can learn and provide education to the local population during their visit here. So after 17 months of planning, finally, Dr. Levy and his team managed to visit Sarawak, Malaysia. And these faculties were here for a week to conduct an educational course that involved a combination of educational lectures, live surgery, workshop, case discussions, public awareness campaign. And participants of the course involved more than just neurosurgeons in training. We are supporting staffs, including our nurses, medical assistants, and doctors from other specialties like anesthesiologists, pediatricians, plastic surgeons, and pediatric surgeons. We also have healthcare workers from the district setting that would like to learn more about pediatric neurosurgery. So looking back to the tier system, I think we moved from Tier 0 to Tier 1 in year 2023 and 2024. In these 2 years, we went through the planning, and the visiting team actually conducted a site visit. We have obtained local admin and organizational support. In terms of the clinical aspect for Tier 1, we identified hydrocephalus and spinal dysmorphisms as areas that we can step up. And we gathered local healthcare workers that are interested to contribute to the service and keep them in the loop. From July 2024 till now, we are working on Tier 1 and we started to transit to Tier 2. We have fixed the broken accessory for the only rigid neuroendoscope that we have and started to embark on more ventricular endoscopic work for hydrocephalus. The pie chart here showed the statistics for hydrocephalus over a period of 3 years before we initiated this partnership, and we can see that only 4% of hydrocephalus cases were treated endoscopically prior to this collaboration, and this translates to about 3 cases per year only. But in this year, we have increased this to 14 cases, and the plan to add on CPC to our ETV is in the pipeline. We used to perform lipomyeloneuromeningocele surgery when a child manifests neurological deficit previously, but we have transformed this to prophylactic resection for the non-complex type after I refined my surgical strategies and technique with Dr. Levy and Dr. Lisa. We have done 15 cases so far following the educational course, and data collection is ongoing for us to track the result and impact after we implement those changes. Epilepsy surgery is another area that we're keen to develop, and we are still at the stage of evaluating the burden of epilepsy in our setting and getting the necessary personnel on board, including a pediatric neurologist. So overall, I think the ecosystem of care framework is indeed a very helpful tool that provides us with a roadmap on capacity building with multiple checkpoints along our journey. But I think a successful collaboration also depends very much on the individual involved in the partnership. We need people who are willing to commit, to teach, to learn together. And I think this is a bi-directional journey. And along the way, I learned that the intention to help others ultimately transform ourselves. So let us continue to raise ourselves to help mankind. Thank you.
Well, thank you so much, Dr. Low. I mean, she was emphasizing on a very important sector in the healthcare system, which is that of the pediatric children. You know, children a priority at the global stage. That's why you see the Millennium Development Goals. One of the goals is focused on reducing the mortality and morbidity of children. And we know in global neurosurgery, emphasis has been laid on collaboration, North-South collaboration. And we can see the results here where collaboration between the high-income country and the low-income countries is resulting into very positive outcomes. Thank you so much, Dr. Low. We're going to move on to our next speaker, who is Dr. Yunus Kuntawi. He's going to talk about fellowships, how fellowships have the impact of fellowships on neurosurgical systems.
Good evening. I would like to say thank you to Dr. Dempsey, Dr. Rock, Dr. Esene, and also Ginny for making this symposium happen, and also to all FIENS team to awarded me for the grants during 2023, where I got the 3 months fellowship in Japan for specifically for doing the endoscopic spine surgery. So I would like to talk, I'm Yunus from Jakarta. I would like to talk about neurospine surgery in our center, about current practices, challenges, and also future directions. So this is my disclosures. I got some grants for fellowship and observership, not only from FIENS, but also from CNS Foundation, Eurospine Foundation, North American Spine Society, and also our spine. This is the overview of my country. We have about 285 million population with only about 550 neurosurgeons, means that one neurosurgeon serving about 520,000 population. In my country, we have 8 established neurosurgery centers producing about 40 to 50 newly fresh graduate neurosurgeons each year. And the number being more great for the spine surgery, we have orthospine and also neurospines, 127 orthospines and 88 neurospines, means that one spine surgeon in Indonesia serving about 1.5 million population. So with 5 orthospine centers and 8 neurospine centers. So the history of Indonesia Spine Society consists of 4 distinct organizations. The first is the Indonesian Spine Society, which belongs to Orthopedic Society, and also the Indonesian Neurospine Society, which belongs to neurosurgeons. And we have also the spine section from each organization, from Ortho and Neuro, the spine section from Indonesian Neurosurgery Society, and also Pediatric Club Indonesia from the Orthopedic Spine Society. So this is my center located in Jakarta, the capital city of Indonesia. We have about 12 neurosurgeons and 5 spine surgeons. So from the neurosurgeons, consists of 3 vascular surgeons, 4 oncology surgeons, 3 neurospine surgeons, 2 orthospine surgeons, and also 2 functional neurosurgeons. The existing facilities for spine surgery in my hospital, actually we could cover most of the cases of the spine surgery, including we have the 3D C-arm, the intraoperative ultrasound, the surgical microscope, the intraoperative neuromonitoring. We also have done the case for minimal invasive spine surgery and also the awake spine surgery, and the uniportal spine surgery, and also biportal spine surgery. And also currently we also have established new services for nav-guided spine fusion. This is another facilities we have to be established by the end of this year. It's a esoscope, the O-arm, And also we have tried the VR guided navigation for spinal fusion. This is our case in my institutions. The dark green is the number of spine surgery. We can see that the number is for almost all of the subdivision is increasing for the surgical cases. And specifically for the spine surgery, also the number for surgical cases, and also the outpatient clinic is increasing. And one of, I think the benefits of fellowship is that after I come back to Indonesia, after went abroad for 1 year, I could held new services in my hospital, which is the transforaminal endoscopic lumbar discectomy, the unilateral biportal endoscopic, the navigation fusion, and also awake spine surgery decompression. This is the overview of spine cases in Indonesia and also in our center. Most of the cases are the degenerative lumbar and cervical, some tumor, some tuberculosis, and some trauma. The challenges we have in Indonesia for spine services are few fellowship trained spinal neurosurgeons in Indonesia, delayed diagnosis, lack of facilities, lack of insurance. So most of the population really depends on the government insurance, which has a really small number to cover, especially for the spinal fusion, and also the implant cost, which is prohibitive to the healthcare budget for the surgery. So this is the 3 months experience I have during my fellowship in Japan. I got my visit in Juntendo University Hospital. This is my professor, Yuko Ohara. And during my 3 months fellowship, he sent me not only to give information to learn from the Juntendo, but also he sent me to some other institution, Aizawa Hospital in Matsumoto, Iwai Hospital in Tokyo, Yokohama, Heiwa Hospital in Yokohama, and also Tokyo Spine Clinic in Tokyo. So the interesting part is I have, with the permission of my professor, I had the chance to scrub, not only being an observer in that institution. So the most important thing I had during this fellowship is I could learn about new technique by doing the interlaminar and also transforaminal uniportal endoscopic, because most of the time all of the doctors there doing the full endoscopic spine surgery. Actually, in my hospital, we have already the instruments and the sets for the full endoscopic spine surgery, but since no other doctors who had the ability to perform the surgery, so the instrument is not used. So after I came back from Japan to Indonesia, so the service for full endoscopic spine surgery is being initiated in my center. So after I went to Japan, I got some other grants from CNS Foundation, our Spine, Eurospine, and also North American Spine Society. So I have the chance to visit Duke University Hospital under Professor Koi Tan for 3 months. And also I went to the GK University Hospital under Professor Kawamura in Tokyo. And I went to Yonsei University Hospital in Seoul under Professor Lee, and I went to Bangkok to King Chulalongkorn Memorial Hospital. So I learned a lot. I learned that from each center they have different uniqueness for their cases and also the approach. For example, in Duke, I learned more about deformity. In Yonsei, I learned more about unilateral biportal endoscopy, and also in Bangkok, I learned more about minimally invasive spine surgery. So this is some of the collaboration between organizations and institutions who have who have helped me a lot during my 1 year abroad in 2024. So the importance of fellowship and observership, I think it's not only that I learn about new skills, but more that I got a new mentor. I got mentorships from all of the professors that I visit for the institution, and we still communicate until right now. So whenever I got some hard case, I consult to them, and they give feedback, a comment regarding the case, and trying to help me to establish services which is not already I had in my institutions. So the mission for our spine center is to build education and training programs, establish national referral centers and surgical assistance, deliver safe and affordable care, develop research in spine surgery. So in our institution also provide give a chance for spine observership for young neurosurgeon who wants to learn new skills in spine surgery. So they come to our hospital to learn. And also I go to their hospital in rural areas to give surgical assistance to them. So our centers starting next month also being the first hospital-based neurospine clinical fellowship in Indonesia, which is a combined ortho and neurospine training program. I think this is the first in Indonesia. I learned a lot when I went to Japan and also in Duke, because they have a good collaboration between ortho and neuros for their spine centers. So the future development in our centers is to build 4 additional spine dedicated OR, to establish a clinical fellowship program in January, to establish a neurosurgery residency program by next year, and also doing more research in spine surgery. So to address the challenges in spine surgery in my hospital, I think the key is to develop the human resources, the complex pathologies, advocate for the facilities for spine surgery, and also doing some strategy for the equipment and consumable needs for the surgery. So in conclusion, developing a spine center is achievable even in resource limited settings, and a stepwise strategy approach and optimal utilization of available resources is required, and collaboration and partnerships between organizations and also institutions are the key. So this is when I accidentally met Professor Dempsey during the last CNS meeting in Los Angeles last October, I think. And I also had the chance to get a copy of his book about global neurosurgery. So thank you.
Great talk, Dr. Kuntawi. I mean, he just expounded on his the impact of the Spine Fellowship, which he did in Japan, and how he transformed the neurosurgical system. You know, to be able to practice neurosurgery, you need a good neurosurgical system to have good outcomes. So despite the challenges in this neurospine workshop, despite the challenges in infrastructure, despite the challenges related to late presentation of patients, he's been able to transform what he learned in Japan during his FIENS Fellowship in improving the neurosurgical system in his country. Thank you so much. So our last speaker is going to be Dr. Joel Sanabria. So he's going to talk to us again about fellowships, what he learned from the FIENS Fellowship. Dr. Joel, you have the floor.
Thank you very much, Ignatius. So I will talk about I'm the 2023 Bassett Fellow. I did at the Toronto Western Hospital in Canada. First, I want to say a few words about my background. So I'm from Paraguay, that is in South America. It's an 8 million population country, and I started my medicine practice here. But the problem was that I always loved to do functional neurosurgery because I started doing neurosurgery in Paraguay, in Asunción, that is the capital. But the problem was that there was no formation of functional neurosurgery in my country. So I have to leave my country. I found a place near 1,000 kilometers in Brazil, in a city called Curitiba, where I received a grant for the World Federation of Neurosurgeries, and in a neurological hospital where I did my formation here. And I started in PGY2 to assist my first Parkinson's disease surgery, PGY4 my first DBS implantation, and I always was very focused and in love with the deep brain stimulation surgeries and all about the functional neurosurgeries surgeries. And in the Toronto Western Hospital, for me, it was always a dream. Sorry. And my problem was that I have no financial support. Yeah. When I received the FIENS support, and for me it was incredible. So I did my formation at Toronto Western Hospital. I did for a couple of months from the FIENS support of the Bassett Fellow. Here I visit not only the Toronto Western Hospital, also the Crane Brain Institute. It's an institute that is focused in research that I am also in love. And my main mentorship and guidance was with Dr. Sunil Kalia, but I also visit some DBS surgeries with Dr. Andres Lozano. Andres Lozano is like a world top neurosurgeon in functional neurosurgery. So to be with him was a dream come true. Then I started seeing some other type of surgery that it was not available in Brazil or in my country, like stereology with deep electrode implantation for epilepsy surgeries. Here are the electrodes implanted, also with the support of Dr. Taufik Valiente, that is the epilepsy neurosurgeon in Toronto. And also I follow up the lead surgeries of laser interstitial thermotherapy. That it's only possible to see them in more developed countries. This is a case of a metastatic posterior fossa lesion treated by laser therapy. Another type of treatment that it's now very followed, especially for essential tremor, but it's also for Parkinson's disease, is the HIFU or high intensity focus ultrasound, where the lesion is made in the MRI device, and to treat patients with essential tremor. So for me, this fellow was incredible, was a dream come true. And with Dr. Lozano, we also accompany very ongoing research projects like stem cells implantation for Parkinson's disease, DBS for dementia, DBS for addiction, liquid biopsy with a focused ultrasound, and electric stimulation in glioma satis vitro. That was the projects of the research that they were going in that time. So for me, I always wanted to know how does those people make so much publication, and then I started to understand how it was, because it was a lot of infrastructure and people behind those scenes. And this led me to have to be in one of the first authors of this publication in the Neurosurgery Journal with the team of Toronto, talking about the adverse effects of DBS in depression. So after that, I have to return to my country, to Paraguay. This is how I thought it would be. But what I found was it was a very difficult, very challenging paces that you have to follow, and to do something that no one made in your country. That was very difficult, but at the end, I could do some things. So this is the rest of my abstract, but I will try to resume it in accomplishment or achievement that we made as a team. So in 2033, we made the first DBS surgery for Parkinson's disease. And this is Dr. Oscar Sevin, that is another functional neurosurgery that made his formation in Brazil, that I joined forces. This was made in a social security based hospital. Then we had a great impact with these surgeries. We have publication in social media with 3.4 million views, and just showing how the DBS works, how it changes the quality of the life and the life of the people. I still receiving a lot of messages daily from people, not only for my country, from Paraguay, but from people all over South America, to know about this surgery, that a lot of people doesn't know that it's possible to make. In this year, we made the first Parkinson's disease surgery in a public hospital, and also the first Parkinson's disease surgery in a private hospital. And a few weeks ago, we made the first dystonia DBS surgery in La Costa Hospital. Also, we developed a national epilepsy surgery program that Dr. Oscar Servin is the leader, but I am helping him. And he made about 57 epilepsy surgeries since 2020. We have the support with the Eli. And also last year we developed the first Paraguayan Epilepsy Congress. I also mounted a multidisciplinary chronic pain clinic hospital in a public hospital. It was had a huge impact in the news also. Then with for people with chronic pain. So my final considerations are the greatest challenge remain the disparity between what we know is possible and the reality of the limited infrastructure, lack of governmental prioritization, systemic inefficiencies. However, this fellowship not only provided me with technical and clinical training, but also renewed my commitment to bringing hope and tangible progress to patients in low-resource settings. The FIENS support was instrumental in equipping me with skills, vision, and drive to lead the expansion of functional neurosurgery in Paraguay. So I always be grateful with what FIENS did to me, and I'm always grateful, and I always want to collaborate with this kind of presentations. Thank you very much.
Yeah, thank you so much. Great talk. I can see Dr. Dempsey clapping, so sharing. So we've come to the end of the presentations. I think the next phase is we're going to listen to all the panelists. We want to hear maybe a word from them. I think we've listened to all the speakers. The common theme was that the FIENS fellowships help in transforming their practice back in their home country, despite challenges related to the creation of a team in terms of workforce, in terms of limited infrastructure, in terms of financing. And it was also emphasized that collaboration was very essential in transforming what the alumni learned in the high-income countries back in their home countries. So I think I will start with Jack. Oh, Dr. David Sandberg is already online. So maybe we start with you.
I'd love to say a few words. So, I'm bursting with pride today, watching these four amazing FIENS fellows give these talks, bringing back what they've learned to their countries and performing elegant surgeries. I think a few thank yous are in order. First of all of these fellows and all the fellows since the beginning of this were funded by Dick Bassett, and I think it's appropriate we mention his name. He's been an incredibly generous donor to FIENS and has facilitated these fellowships being possible. I'd like to thank Jeannie Bray for her amazing hard work and her team, Sidra, as well, at going through all these applications. I'd like to thank Gail Rousseau and Raji Mahmood, who together with me over the years have reviewed all the applications. And I would say every year there are more applications and there are more talented people, incredible people, and our decisions are very difficult. And finally, I'd like to thank Dr. Dempsey, under whose leadership these fellowships have flourished and created an organization that I believe is truly changing the world of pediatric neurosurgery. So what a wonderful celebration today is. And thank you to all the speakers. Congratulations.
Thank you so much, Dr. David Sandberg. He is the FIENS board member. I think we'll move to Jack. I don't know if you have some comments related to the presentations before we start taking the questions.
Okay, well, I think to Dr. Akhmediev, Low, Duarte, and Kuntawa, these were really excellent presentations. I wasn't sure what to expect. They're really world class, just terrific. And it's really kind of heartwarming to see what kind of impact, even in a small way, FIENS has on your practices and the practices of all the other fellows. And I'd agree with Dr. Sandberg. I mean, a tremendous thanks goes out to Mr. Bassett. It goes out to Dr. Dempsey, who I've been with FIENS for a long time now, and Dr. Dempsey has really kept a target on how we can really help across the globe. And honestly, Jeannie, without you're in the background managing all this, I don't know how this would even ever be able to come together. But Ignatius, this was a terrific idea you came up with, and I'm just thrilled to be a part of it.
Thank you so much. How I wish the sponsors and the mentors were here to see their fellows and what they are doing back in their country. I will pass. I think there are no questions inbox. I think we'll have to look at the questions before we give the floor to Dr. Dempsey. Jenny, there seems to be no questions in the chat box. So since there are no questions, I will pass hand over the floor to Dr. Dempsey.
Well, thank you very much, Ignatius. This is really a stellar accomplishment. Remembering, though, that it's one step in a process that is trying to address a phenomenal millennial-long need of care for people worldwide. And that's really what we're learning today. The benefits of these programs and benefits of this very program today are very broad. Remember, first of all, that we are primarily benefiting patients. Our present patients, the ones that haven't even been born yet, we saw these pediatric presentations, that's phenomenal. And when we do work to improve that infrastructure and to teach others, we magnify the impact of what we can do as surgeons worldwide tremendously. We each can probably take care of thousands of patients, but together we can take care of millions, and I hope one day billions, because that's what the need is. So there's some very, very important points that we learned today. First, we have to be grateful to the people that really allow this to happen, the Jeannie Brays, the Dick Bassetts, the Clack family. They have really been inspirational to us, as have been our patients. Second, this learning is a two-way learning. I never go anywhere without learning something. I'm glad to say I have a lot more to learn. And, people may think that certain of us are mentors and certain are trainees. It's not true. We are all learning from our patients, and we are sharing that through a collaboration and a network. I mean, the major goals of these fellowships are to increase your education, to expose you to new ideas and thoughts, and to have you encourage and inspire the people that thought they were trainers, but really found that they, as mentors, were also being mentored. So this is a bilateral learning system. I'm very, very proud of what's going. I'm very happy. Jeannie and I have been working hard this fall so that at the winter meeting of the FIENS board, I hope to announce a 50% enlargement in the fellowships, both these training fellowships and the completion of education fellowships, which were pioneered by the Clack family, through a numerous number of network of philanthropists and of FIENS itself that we have put together. And I also hope to announce a second program to try to prioritize key equipment such as the first microscope, the first drill, or the first endoscope in particular areas, emphasizing those areas of our fellows, our alumni, the need, so that it will forever continue to lock us into lifelong learning, where the fellows, as they graduate, will become members of FIENS, first as young neurosurgeons in your program, Ignatius, but then as sites for volunteers, and they themselves volunteering to train others in their region. So we're very excited about the direction this is going. We're very excited about the direction that all global health is going, and look forward to seeing many of you at the international meetings, perhaps at the April meeting in Dar es Salaam. Thanks so very much for all the effort everyone put on. And I echo everybody. Ignatius, we give you tremendous credit for this. Jack, your leadership, but mostly Jeannie, who does all the work and keeps me on the straight and narrow as I'm running around. She knows when she gets me during the OR days. So thanks so very much to everyone. Thank you.
Thank you so much. Jenny, do you have any final words for?
Thank you, Ignatius. So you had a vision about doing this, and it's now a reality, and you brought together an incredible group and sharing just such inspiring stories. I can say for myself, it's morning here, and this day is going to be filled with just really great thoughts about all the work that you've shared and that you've done, and the successes of this fellowship, and of all the work of the FIENS board, the FIENS team, the generous donors, Mr. Bassett, and the Clack family, and all of the people who have contributed to FIENS in small amounts, in large amounts, in everything in between, to just increase neurological surgical capacity globally. So thank you. It's been a pleasure. I'm very grateful, and thank you for all your hard work. And the presentations were just incredible. They're so comprehensive, incredible pictures, so engaging. This is a really great turnout of people who are attending. I think, and that just really shows how everyone is interested in the work that you're all doing. So this video will be up on the website for future reference. And so if anyone wants to share with their mentors the link, then they can do so, and they can watch at a later time. So stay tuned. There's more fellowship or webinars coming up soon. And hopefully next time we have this meeting, maybe it'll be in person.
Thank you. Merry Christmas to everyone.
All the blessings of the season to everyone. Thank you.
Thank you.
Yeah, thank you.